What are the early signs of autism? A question often pondered by parents and caregivers worldwide. To understand autism spectrum disorder, or ASD, we need to delve into the early telltale signs that might indicate a child's different developmental trajectory. Firstly, it's crucial to remember that autism is a spectrum disorder, meaning that its manifestations can vary widely from one individual to another. However, there are common early signs that we can look out for. One of the earliest signs might be a lack of social responsiveness. From as early as 6 months, babies typically begin to engage in social interactions. A baby who doesn't respond to their name, avoid eye contact, or seem interested in other people might be demonstrating early signs of autism. Language delays are another common sign. While it's not unusual for a child's speech development to vary, a significant delay in language skills could be a sign of ASD. This might include not babbling or cooing by 12 months, or not using gestures such as pointing or waving by 14 months. Next, we have repetitive behaviors. Children with autism often engage in repetitive movements or behaviors. These can include rocking back and forth, flapping hands, or obsessively arranging objects. Another sign to consider is the lack of spontaneous or make-believe play. Most children engage in pretend play, such as feeding a doll by around 18 months. Children with autism, however, might struggle with this type of play. Lastly, we have unusual reactions to the way things sound, smell, taste, look, or feel. For instance, a child with autism might be overly sensitive to light, sound, touch, or other sensory stimulation. In conclusion, the early signs of autism spectrum disorder can include a lack of social responsiveness, language delays, repetitive behaviors, absence of spontaneous play, and unusual sensory reactions. However, these signs alone do not confirm a diagnosis of autism. If you observe any of these signs in your child, it's essential to consult with a healthcare professional. They can provide further evaluation and guide you towards the appropriate next steps. Remember, early intervention is key. The sooner a child with autism gets help, the greater their chance of leading a healthy and fulfilling life. This is why understanding and recognizing these early signs are so crucial. And so we loop back to our initial question: what are the early signs of autism? Well, now you know. Stay curious, stay informed, and most importantly, keep an open dialogue with your healthcare professionals. Knowledge is indeed the most powerful tool when it comes to caring for our loved ones.